As a fellow, I'm here to help you with so many things, from the beginning of your fellowship to the end of your fellowship when you graduate. If you've been in a residency, then you've had a coordinator, you kind of realize what a coordinator does. Those are the things that I do, from starting with your interviews and all the way at the end to when you're getting ready to graduate and everything in between. So your orientation, your scheduling, anything that you need, I'm here for you. A lot of administrative tasks. You need someone to talk to. We're just really excited that you're looking into our program and that you'll be part of one of the first programs here for pulmonary and critical care.
So we have plenty of ICU experiences. We are one of the services, medical critical care is one of the services that provides ICU services in the system, along with trauma and acute care surgery and neurocritical care. The medical critical care is the biggest partner in providing critical care services. We currently take care of 4 critical care units, which is medical intensive care unit, pulmonary intensive care unit, cardiac critical care, and cardiovascular intensive care unit. We function in different units, we function in different capacity. The medical critical care is a flagship teaching unit, so that is where the team consists of the intensivist and resident physicians and hopefully in the future fellows. The other units are staffed by the intensivist and the nurse practitioner.
The APPs are an integral part of our critical care medicine team. We work side by side all the time. And the APPs are really excited about sharing our knowledge, just because we've done this for a long time, and sharing our tips and tricks of how to navigate the system and critical care and patient care and procedures. So I think we're going to become close friends in navigating how this works. Sometimes even for the residents that we already work with, we are a non-scary place to get an answer to questions if you don't want to go to the attending. So.
One of the great things about education is, we are, as doctors, we are all lifelong learners. We spent an enormous amount of time going through post-graduation and fellowships and residencies and all of that. And that learning never ends. And the benefit of having residents and now fellows is that it allows you to continue that education. To teach somebody, you have to learn yourself first. And it allows you to continue that lifelong learning track. So having fellows, having residents provides that boost, that passion that you have for education. It allows you to continue that.
So one of the beautiful things is that, when I moved to the East Coast, I moved to Wake Forest University to do my residency and fellowship. And so I was on the eastern portion of the Appalachian Mountains, really taking care of a lot of disease pathology at Wake Forest. And then when I went to Tennessee, I actually went on the western portion of the Appalachian Mountains. And now I get to, practice in the, lower portion of the Appalachian Mountains. So really the patient population that I've taken care of since 2008 has been, the same patient population, in the sense that there is what we see in this area is a lot of smoking, a lot of lung disease, and there are just really the full gamut of lung disease in this area, and I'm really excited to still be here in the South taking care of patients who have this diversity of lung pathology, which we're really excited for the fellowship, in the sense that we can offer the level of education as far as disease pathology for our future fellows.
For the incoming fellows, the ones that are wondering why they should apply here or why they should join here, I think the great thing about this place as a community hospital, it has the resources for wonderful education. And at the end of the day, the thing that we care about as doctors is what kind of education is being provided to us. And when we move on from the fellowship we carry that education with us. A lot of the learning that I did in my fellowship, I still to this day use it. And I can confidently say that, that level of education can be provided here in this fellowship. The structure is sound, the setup is sound, the education is sound, and hopefully the experience will be sound. And so I think the incoming fellows will have a wonderful experience from that standpoint.